My name is Nik Haliasos. I'm a neurosurgery consultant. I treat a variety of problems relating to brain, spine, and peripheral nerves. What patients I think they need to know that despite me being primarily a surgeon, nowadays with the advanced technologies, not necessarily all problems relate or arrive to needing a surgical procedure. There are many conditions that we can treat conservatively first. The most important thing is to be able to offer a personalized approach to every patient and guiding them through the process of these conditions. And I would like to mention a few through this process. I have a significant expertise on treating people with brain tumors. Of course, this is certainly a devastating diagnosis for the patients and families. What patients need to know is that there is a number of tumors that they do not need to be treated operatively, and we need to know when to operate or when to monitor. And even if the point we reach a point that we need to do an operation, then it inspires confidence to people to know that we are using the best techniques and advanced tools like advanced MRI technologies that we are developing in this hospital. Even if people have already asked for an opinion, they already have an opinion from a colleague, being this such a serious problem, I think it is never enough to also ask for a second opinion if they wish for conditions like this. A rarer problem that is actually quite devastating for patients that I treat relates to the facial pains, and people may have heard of the term trigeminal neuralgia. So in these conditions, throughout the patient's lifetime with this facial pain problem, there are moments when the disease breaks through. There are exacerbations of this pain. And in those scenarios, medication doesn't work anymore. So we have a procedure that is done as a day case that is called trigeminal rhizolysis, where we create a temporary damage to the nerve enough that we reduce this burden, this acute the acute pain. So we give relief to people, and that is something we can repeat again as a day case. Ultimately, another condition that it probably may affect quite a bigger number of older patients is called normal pressure hydrocephalus. This is when people, as they grow older, the fluid in their brain becomes a little bit more than it should be, and this starts to affect their cognition, their walking, and their memory. There is a percentage then of these people that we could help them significantly by placing a so-called brain shunt, that is a small tube under the skin that offloads this fluid constantly. But this needs a very careful selection. So together here with our neuropsychologists and our neurologists, we can investigate people and reach a decision whether that would be the ideal option for them. So I think overall, if patients they suffer from symptoms or conditions that we have touched upon today, I think I would urge them to get in touch with us, book an appointment to discuss the problem with the philosophy to navigate them through their issues, either in difficult or easy situations. So despite what people think, and I'm sure someone that is not expert on the field may consider this something extraordinary, the majority of my patients that we operate would go home on the second or third day after the operation. The reason for going to ITU is not necessarily a relation of staying a day in the intensive care. It's not necessarily a relation of the severity, but it's actually we do this because we have an excellent facility and we want to have the best monitoring in the first 24 hours of somebody's recovery. But again, the people come out in a very autonomous. They can go back to their normal activities within weeks, and I think this is something to. I think we should demystify this problem and put it in the right context with, of course, the best tools that we can use. It is important to know that even in tumors that are so-called in difficult areas, and difficult areas of the brain would be very close to the speech or very close to our motor function of our arms and our legs. Again, we have techniques where we can approach these areas and safely remove the tumor without affecting these functions. Let's look at the cosmetic side of things. So the good thing about the brain and the head is that the scars here heal very nicely, and of course there is always the hair that people have and that certainly covers these scars. Scars would heal within a period of 7 to 10 days, more or less. The important part, that is actually the follow-up that we do, relates to the aftermath of a brain tumor operation, because it is like starting a journey with the patients. The first part of the journey is the brain procedure, and then the follow-up would relate to offering them options together with our neuro-oncologists and our multidisciplinary team meetings that they happen here every month, to offer them the best post-treatment option that may be relating to oncological treatments or radiotherapy. So there is a very frequent follow-up in conjunction with our oncology colleagues.